Hey everyone, in today's video, I'm going to show you how to use a urinary catheter irrigation tray. So let's get started. If you're looking to improve your nursing skills or to gain more knowledge about the nursing career in general, please consider subscribing down below. I'll be uploading a video every Wednesday and Sunday, and you don't want to miss out. So a urinary catheter irrigation tray is used for unclogging sediments that may have built up from the tip of the bladder to the urethra, which make it really difficult for you to drain a person's bladder. So the first time I actually ever used a urinary catheter irrigation tray was during my first month of practicing as a registered nurse on an acute medical surgical floor. Now, my patient had contact precautions and I was guiding a student. So I was very stressed out because it was the first student I ever had, and I wanted to teach them how to put in a catheter on a female patient. And of course, I asked for the patient's permission, and she was okay with having the student place a catheter. As we were putting in the catheter, we noticed that we had really difficult time emptying out her bladder. No matter what we did, we kept inserting the Foley, but it wouldn't work. And I would make sure that I was inserting it to the urethra. Now, at this point, I had a gown and everything because she was contact precautions, and I was sweating so profusely because I didn't have the answer. The student was looking at me, the patient was looking at me, and I had no idea what to do. So I thought I would make this video and teach everybody troubleshooting tips for inserting a urinary catheter. So what you want to do is grab some normal saline or sterile water, whichever one you prefer. Generally, you use normal saline, although there have been times where nurses have used sterile water. I always use normal saline though. So what you want to do is draw up normal saline into here, and you want to take out approximately 300 cc's. Now, if the bladder is really full, obviously you want to use less normal saline and irrigate with less fluid because you don't want to overload the bladder, which could be very painful. But essentially what happens is patients who come in with a UTI have some sediment buildups at the tip of their urethra from the urinary bladder, and this allows fluid to go back up the urethra and unclog any sediments that may have formed around the urethra from the urinary bladder. And yeah, so all you do is there should be two holes, obviously, one so you can pump up the catheter, and the other hole on a catheter is to drain. So what you want to do is you want to put it into the one that's draining, not the one where you twist and put the balloon, and you pump 200 to 300 cc's in there, and eventually, if you get it done correctly, it should unblock the sediments that have formed and allow for proper drainage of the bladder. I hope you guys enjoyed this video. I thought it would be interesting to share one experience I had with a urinary catheter irrigation tray. If you enjoyed it, please give it a thumbs up. Please consider subscribing down below. I'll have more educational nursing content in the days to come. And let me know in the comments below if you have any other crazy stories with patients about troubleshooting anything in nursing. Thank you guys for watching, and I'll catch you guys in the next video.